friends, I am Dr. Uzair Kasrani. Today we are talking about the ergonomics of the laparoscopic surgery. Now, why we know the ergonomics of the laparoscopic surgery? Because the open surgery is quite different. You have a wide vision, you can assess the tissue, you can manipulate it, you can feel it, you can have a tactile sensation, you have no dark room, you have no cluster effect, your hands are not affected by the pistol grip instrument of the laparoscopic instruments, and you have no neuropathic, you have no cervical spondylosis issue, and much more. But in case of laparoscopic surgery, these all things are assessed and in fact bothered by the surgeons during surgery. Now the ideal position, what is the ideal position to standing a surgeon in case of laparoscopic surgery? Now one thing you should remember it, the target organ which you are going to hit or you are going to operate, on that side monitor should stand, and on opposite side all your instrument and your cameraman will stand and assist it. Now the position is, the monitor should be 15 to 20 degree below the site of the surgeon, and the instrument are at the level of elbow, pedal is same at the level of the foot, in order to avoid any hindrance. And in fact the problems which I have already tell you, the neuropathy, cervical spondylosis, thenar neuropathy due to pistol handle effect of the instrument, and you see the baseball concept which has been arise through the baseball ground. Mostly in our country no one is using a baseball or no one is playing baseball, so you can see in this picture which I have shown you here as well, in the baseball concept is that one is the working port. In fact, one is the who has a person who has a bat, he will hit the ball, and the other person which is away from him is in the center, just like parallel to him, and there are two lateral persons who are persistently in case of running from one side to another side. This will give you concept of port placement, which is very much understood in these pictures of baseball ground. Now the angles which are used in laparoscopic surgery, there are three angles which should be known to every laparoscopic surgeon. One is manipulation angle, which should not be less than 45 degree and not more than 60 degree. Another is azimuth angle, which is the angle between two instruments posts, which should not be less than 30 degrees. So the instrument should not collide and there should not be any hindrance in it. And another is elevation angle. Elevation angle is almost about 60 degrees. So in these angles are basically made because of the persistent hindrance and persistent of the issues which were came in the sides, and it will lead to a very good laparoscopic port instrument handling. Now another two terms, one is triangulation and other is sectorization. Now triangulation, there is no uniform consensus about port placement for advanced laparoscopic procedure. The port placement is currently dictated by the surgeon preference based on the individual experience to facilitate smooth instrument manipulation along with adequate visualization during laparoscopy. Usually tocars are placed in triangular fashion. This is termed as triangulation. Target organ should be 15 to 20 cm from the central port used for placing the optical tocar, and the two remaining ports are placed in the same 15 to 20 cm arc at 5 to 7 cm on either side of optical tocar. This allows the instrument to work at 60 to 90 degree angle with target tissue and avoid problem for long handle and for port placement. Now another is sectorization. When optical tocar is placed on one of the lateral ports, they are termed as sectorization. In fact, these sectorizations are made because they are another term labeled as handling instrument. Sectorization of instruments should be avoided by beginners since it requires a greater degree of understanding and experience for the laparoscopic view and significant different hand-eye coordination. And another factor that one should consider during trocar placement is that instrument length is limited. If trocar is too far from the desired position, then one should be pushed the abdominal wall toward target organ to gain a few centimeters. This is not only makes these movements less precise but also cause strain on the finger and hand instruments. Now the laparoscopic surgery provides a patient with less painful surgery but is more demanding for the surgeon. The increased technology complexity at some time poorly adapted requirement and environment had led to increased complaint of surgeon failure and discomfort during laparoscopic surgery. Now the physical strains of surgeon due to insufficient of the ergonomics application can lead to neck pain, spondylosis, and other physical constraints reported as cervical spondylitis, shoulder pain due to abduction of shoulder, chicken wing scapula during laparoscopic surgery terms as laparoscopic shoulder, backache, hand finger joint pain, tenosynovitis, burning eyes, stress, exhaustion, hand muscle injuries. These are the fate if the ergonomics are not maintained. Now the suggested position for arm is slightly abducted, retroversion, rotation inward at shoulder level. The elbow should be bent at 90 to 120 degree. And surgeon has to be remembered that moving about and losing up his hand intermittently is essential to prevent to build up lactic acid in the muscle in order to avoid fatigue. Thank you. This was all about the ergonomics of the laparoscopic surgery. I may understand it will provide you some benefit and increase your knowledge. Thank you for watching.